what lessons have you learned as a health system CIO?
Look, I think the most important lesson I think for me is the nimbleness and ability to make quick decisions was just amazing. Countless times our teams faced an issue without calling themselves tiger teams or any other fancy names. Individuals got together, discussed the issue, came up with a solution, and implemented it. Right? It was just a amazing process, right? Which basically, and this happened at all levels of organization. It happened at leadership level, it happened at the mid leadership level, it happened at analyst level, right? In which told me that our prior to COVID, if you had asked me, I would say, yeah, health systems tend to be bureaucratic, especially if you're in an academic medical center. It takes months and months, sometimes years, for us to make decisions, simple decisions like standardizations or a product, etc. And frankly, what lesson learned for me, one of the biggest lesson learned for me is, that look, we can operate in a very nimble way, almost like a startup. And how a question for us, frankly, is how do we preserve that? Because we were forced into the situation where we had to act a certain way. We acted, and I think we were incredibly successful. How do we preserve that nimbleness, the trust that we have created among each other, the whole mantra of decide, communicate, and execute? We just need to move it forward.
Yeah, and that's, it's interesting because that's one of the hardest things as a leader is to get that momentum going. And the silver lining of the crisis was it was the impetus, it was the momentum, and it did prove we could do things we never thought possible, which was pretty amazing.